What's going on, everybody? It's Anthony Russo from #BeTheChange. Truth will set you free. Now, blunt force discussion, a whole bunch of stuff. But obviously, this is on the Truth will set you free podcast. We've got a fun interview that we're going to do today with somebody that's going to talk about a field that we talk a lot about on our shows, which is, healthcare and all the issues going on in the healthcare medicine profession. He is a cardiac surgeon. So without further ado, first, we're going to do a little countdown. We're going to get the show started. And we're going to look forward to this interview. All right, everybody. Our doctor today is a cardiac surgeon. He's also author of a book called Healthcare Anonymous, Put Yourself First to Avoid Anxiety, Addiction, and Burnout. If I could, I'm going to introduce our doctor, Dr. Simon Maltais. What's going on, Doc?
Hi, Anthony. How are you?
Good. Did I pronounce that name correct?
Yeah, you did good.
you French people, you Canadians, and all that.
Always special, right?
It's so special. So you've got a really wide background. You've done a lot of stuff. Before we really get into topics, introduce yourself fully. Tell us what you do and what you've done over the last few years.
Yeah, so my name is Dr. Simon Maltais. I'm a cardiac surgeon, originally trained in Montreal. Also did PhD there in biomedical engineering. Went on and had a career in heart transplantation and mechanical heart, combination of Vanderbilt and Nashville and Mayo Clinic in Rochester, Minnesota. And then over the last 2-3 years, have developed an interest in mental health, in healthcare, going through some issues myself, decided to dedicate a part of my career into making people better, making myself better, but helping others do that. So through journaling, interviews, we came up with a book called Healthcare Anonymous, which is really a journaling of a lot of different people within healthcare telling their story about their problems or their challenges with their own personal life through their own words in healthcare. And so my role within this book was to bring it all together. And so, so the book came out about 2 months ago, and now I'm a practicing surgeon as well. I'm still working. I'm actually moved to Montana in November. So I work with Intermountain Health. I think part of it has to have with the Yellowstone show. I live in Yellowstone County, so I had the attraction to the nature and the mountains, and now I dedicate part of my career to coaching and health and life coaching as well. I'm trying to make people better within the system in other realms such as businesses and professional sports.
Yeah, now that you're living in Montana, well, I'm in Texas, so I don't complain that much, but I'm officially jealous that you're in Montana. That's if there's a place that, you could be right now, it's like, all right, Montana, Idaho, to just do what you got to do. Exactly.
Live. Right.
So your book, I'm going to put it on the bottom. It's called Healthcare Anonymous, Put Yourself First to Avoid Anxiety, Addiction, and Burnout. You can find that on Amazon for anybody looking. Before we get more into the story, who is that book for? Who would you suggest read that?
Well, I think first and foremost, it's for healthcare workers, right? Not only doctors, but anybody who has worked from close to far in healthcare, have helped patients. It could be in different areas. Rehabilitation, hospital settings, community hospitals. And it's really, to help people understand the struggles and the history of the changes within healthcare and the pressure that is put on healthcare workers. And so healthcare workers to start with. And then I think I'd like to even say it's for the general public as well to understand the challenges that, our nation's sort of the biggest employment system and most essential one has gone through over the last 2 or 3 years. And so I think for the public to understand what it looks like and why is it so important to have healthy workers and what are the challenges for them and how does it impact them as a direct care standpoint. And so I think primarily for healthcare, and I think some of the topics within those The book, we touch base on perfectionism. We talk about the pressure of performance. So I think extending those concepts to other high intensity environments. We talked about, businesses, music, sports, entertainment, and things like that. So a lot of the concepts within that system will help, I think, others function within those high intensity environment where you really have to give yourself completely.
Essentially a life or death situation. So I got to ask the question. We'll jump right into it. Obviously, in terms of what healthcare workers have gone through, did you start writing this book before COVID or during COVID?
It was a little bit before COVID, going through personal challenges myself. I went through a major depression, struggled with some alcohol issues as well. And it was a bit before COVID when I started really journaling, and that was really powerful for me, journaling about the bad stuff, but also the things that I was doing well when it was going well as well. Sort of this concept of green lights, right? That McConaughey's talking about in his book.
Yeah.
And then doing that, I started to expand a little bit and talk about it. And some friends, whether it's nurses or colleagues at work, started to also express some of that stuff, of course. And then COVID sort of appeared within that period with everybody, and it put everything on steroids, so to speak. And people were coming out. I had to say no to people because there were so many stories.
Yeah.
And actually, I've documented them, but wasn't able to put it in the book.
Wait a second. Did you set up this whole COVID thing so you could have content? Was
Yeah.
this on you? Do you work with the pouch?
That's right. I'm ground zero. I actually think I had COVID, like my wife and I did, coming back from Mexico way back when, in February of 2020, I believe.
Oh, early adopter. I get it.
We didn't know then, but we were super sick for a month. But anyway, point is, it was a bit beforehand, going through some personal things myself. And actually coming out of COVID, I was really more on the path of recovery through that book, through the sort of collecting of various stories, and so it's a bit of a mixture, but it's certainly tainted by COVID situation.
Gotcha. So now with COVID, so what are you currently? I know you're working on this. Are you? And you talked about what you're doing in Montana, especially working with different doctors. Are you still a 100% practicing physician in the Montana healthcare system?
Yeah, no. So I was fortunate enough to, and I talk about this in the book, right, to really kind of decide to own my practice. I was always sort of depending on wherever the system was going to bring me, to the Mayo Clinic, to the sort of the highest place I could literally go into healthcare. And then through personal stuff, I decided to really control my schedule. So I pitched and I did a various system during COVID. I said, listen, I'm going to be that type of surgeon, operating a certain amount a time, but I want my time off to focus on the things that I think are important, to resource myself and to come back as a better physician. So I actually have probably I'd say 2/3 practice now, where I practice 20 days a month, and it's pretty efficient. It's busy. I do a case a day, a case a day, 4 days a week. And then during that other part of my life, the time off, I dedicate my life to mental health, and have a coaching business. I give talks around the country. The coaching business is called Breakthrough Points, and the concept is expanding the struggles that I believe we have in healthcare and have common themes to other businesses, such as professional. So I follow clients on that part of the month where I'm sort of not a heart surgeon, so to speak.
I gotcha. So you talked a little bit about something called healthcare disease, talking about the system as a whole, and a lot of the viewers that I have and the following that we have, we are under the belief that the system is broken on so many different levels, whether it's the way they treat the patients, and also the fact that we do overwork our doctors and nurses to a breaking point at this point. And we can even get into the fact that they let go of some unvaccinated doctors and nurses, even though at the time we needed everybody we can get our hands on. So right. Is the system getting you well, creating sick workers? Is there a sacrifice one way or another?
Yeah, so healthcare disease, to me, was really the important concept. It was describing a more of a chronic process, um, in which workers, right, people that are taking care of patients, have acquired a set of things. And the way I've described this disease is in three different poles. The patient meaning the host, right? So the person that works. So the things that you have acquired yourself that will make you at risk of developing a problem. So perfectionism, self-criticism, things like that. And they're not all like you're doing. There are things that are in the culture of the system. Then there's the environment, right? So the things that are there, right? The pressure, the call schedule, the letting go, the hours, so the things that are there within the system. And then the third part is the what, right? So how have you developed mechanism over the years to counteract those things? And just like any other diseases, one of those poles becomes sick, right? The host, the environment, and when it comes together, then you develop this more of a chronic process, healthcare disease, and you manifest acutely manifestations such as burnout, anxiety, depression. So and if you don't fix the underlying disease, right, the way you interact with the system, you don't control the system, you don't change the way you've coped with it for so many years, then you're just right back in, and 6 months later it'll be something else. It'll be alcohol, it'll be another depression story, and so you get in this cycle, and all of a sudden you wake up, you've lost 10 years of your life. So that's the concept, right? So it's like you have this chronic disease called alcoholism, but then you work right back at the liquor store.
Yeah.
If you don't change the bottom problem, then you won't survive, right? It's like being diabetic and working in chocolate factory, right? So that it's like you have this concept of misadapted process within the system that leads to burnout.
Yeah.
And then if you don't make a deep change, then you sort of just repeat the same old vicious cycle, so to speak.
Yeah, it's weird. I mean, part of being, and not, I mean, nurses in some ways, but especially somebody like a brain surgeon or a cardiovascular surgeon, you are the top of what you do. You have to be. You have to be intense. You have to strive for perfection. And I speak. I'm a speaker myself, and I talk about how perfection is not attainable, and it's not something to look at, and failure is a positive thing, and all these things. But for what you do, you guys in school are the ones that have to, it's almost like Top Gun of being in the medical profession. You want to be the best, and you have to be the best. So that cycle keeps bringing you back. Like if you are, I mean, you are Mayo Clinic, Vanderbilt, obviously phenomenal institution. You are at some of the top of the top. So that burnout is bound to happen. And I'm assuming some of the doctors feed off that burnout, which could be almost like the reason why alcohol or drugs sometimes dependent, because you have to keep building yourself up to be in your head who you have to be to do what you do.
Well, I think the word that comes to mind when I hear you speak is normalization of behaviors, right? We feel like being burnout or tired or depressed is normal, right? And then being angry is normal because for the greater good, because I'm a heart surgeon, I sort of have to be angry.
Right.
That's how I need to be just in order to cope with but being angry is not normal. It's symptoms of depression. It's a deep emotion that your body is expressing because you can't deal with a certain amount of stuff. And so we feel like normalizing stuff through the system is okay. And the reality is you can't go on like this, for many years without having some of the issues, whether it's the divorce, whether it's the alcohol, whether it's all of them, whether it's HR visits, so that kind of stuff is normalized within the system because it has to be like that. And it's a hard wheel to turn around because you don't have to be like that. And it's not okay to be tired or angry or being sort of baffled by the system, constantly. You sort of have to be in control. It's a job, right? You're not the, I like this expression. We're just another bozo on the bus. And a lot of us don't realize that. You're not driving the bus. You're not pushing the bus. You don't decide where the bus is going. You just play a role within a really big system.
So how do you get, so like you said, because again, it is this cycle. How did you, or how do you recommend breaking that cycle for people in the medical profession, especially with how, well, for the most part, in some places, short staff. So how do you break that cycle the way that you have been talking about it?
Well, you sort of have to slow it down. I think we described this in a couple of stages in the recovery. What I think has helped me and others, sort of so to speak, and and the first step is a pause, creating time, realizing that doing a lot of stuff is not efficient. It leads to mistakes. It leads to errors. I mean, Vanderbilt had a huge. I mean, how do we? And now we're being punitive on mistakes in healthcare even. So I think realizing that doing too much stuff is not productive, and taking a pause to create space. So that means saying no once in a while. I'm saying wait, I got to think about it. So it's being in control of your schedule. It's on a daily basis creating this pie, right? So that 90% is not a given to work, right? So work, community, health, family, every day you sort of have to reassess where you're at, what proportion of stuff. So if you have a big day at work, it's okay to turn off your phone at night and be with your family and spend that time with it. So I think creating space for me, it led to a 3 to 6 months off, semi off, where I did locum here and there, and then I went to Thailand for a while, because my health was also in danger, from obesity, from alcohol, and so it made and I was in so name a committee. I was on every single committee. I was on a plane flying about 40,000 miles a year, and then it was super busy heart surgeons, and I thought that's what I needed to do. So creating space, and then realizing that, and I speak about it in the book, and don't take it the wrong way. Say you are not God, and it's not because I relate to God complex or anything like that. It's because we act upon in the system, for example, an operation for 4 hours in someone's life, right? That has been maybe smoking or to not eating badly for 25 years, and so we act and try to reverse this is very difficult. And so decreasing the anxiety of doing a job well done, and the complications that are right, because the patients are getting sicker, whether it's from COVID, whether it's from technology. People are just living longer, and so if the amount of pressure there is to help those people, but also so realizing that you're part of a system, you play a role within it in a very acute moment, and that sort of has an impact on the way you treat patients and anxiety. And then,
Sorry,
what?
go ahead.
No,
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 keep
no,
going.
no. Go ahead. I was going to move to a different topic, but
Well, how I just want to, for your aspect, how long did it take for you to truly start recovering your body with your weight, with your overall health, alcohol?
Uh,
How long did
geez,
that
it took
process
it
take?
took this. It's still a work in progress, but it took acutely a good 6 months to a year, where I had to, um, remove negative influences and understand the impact that it had on me. Negative influences from all the place, right? Whether it's friends, whether it's food, whether it's work, so controlling that environment, working on myself also to be okay with that, because there was part of me that wanted to write a paper, be on this committee, write that, to be, so that the guy, and that's a constant struggle to say, okay, where do I put the line, and why do I put that line, because it's healthier for me. And the weight loss really helped, the sleep, dedicating time to health and exercise and things. I lost close to 40 some pounds, which is not subtle.
No, it's game changer this day and age.
Absolutely,
Yeah.
absolutely.
So with the environments that you're in, high intensity, and I like you said, God complex. That kind of relates to the that Top Gun mentality, and
Mhm.
you're stepping away and you're realizing you're not God. Obviously, incredibly important from a mental perspective. How these high intensity environments have impacted delivery of care and performance across the board for medical professionals, whether it be doctors or nurses.
Well, I think one of the big, two or three of the big sort of things, at least administratively, I would say, are the medical record system. So, medical record system is a good thing because it catches billing. It's good for documentation. It's easy to find, but it really has put a heavy burden of documentation on everybody. When the nurses are probably at the tip of that, but they have to. I mean, they're probably half their time in the ICU or other settings are dedicated to charting, so that's, and then you get constant email. This is not correct. There are people that are being paid to find errors, right? So not that it's not okay, but it really has put an enormous amount of pressure on people. The other part of it, the other part that's important to me, I think, is the transforming healthcare into a business, right? So hiring business people with no medical background, with MBAs or sort of from medical sort of background, business background, into leadership positions, CEOs. And so, you're measured now on the amount of cases, the percentage variation, the money, the savings. Whether I think the most important thing is whether you can get a patient out of hospital safely. Now it's how much sealant I use and which type, because it's too expensive. If I feel like a valve is better than the other, I can't really use it, and because it's part of the system, and so hospital, or I have to transfer the patient because my hospital has decided, for example, not to have in consignment this because it's too expensive. So ultimately that puts pressure on us and has a direct impact on patients. And so the way the system has become more administrative, and a lot of people, it used to be like, not even too long ago, 20 years, 20, 30 years ago. And some institutions have still that model, but doctors were and nurses were in position of power because they knew how to take care of patients and what was important to them. And so that to me has had a tremendous impact. And the third part I would say is, sorry, it's a long answer for sure.
You're good.
It's the realization that human resources within the system is the most important aspect of the survival and the costs of care in the United States and in Canada. So that if we don't take this seriously, what I was reading this morning is that 11% of medical students have thought about suicide within the last 2 years. The amount of burnout, the people that fit criteria for burnout and depression in specialties like ICU, gynecology, is up to 50%. 50% of people meet criteria for depression. So that's a big deal. So that is to be it's not about how much money we inject in the system, how much hospitals we inject. It's that the human resources is what's going to affect directly patients. If people can't do it, there's not a week now that I don't hear somebody either transferring hospital, going somewhere else, or changing to some other specialty, or going completely to just do veins. Heart surgeons and vascular surgeons going to like private clinics, assist plastic surgeons, or do vein harvest because they just can't take the system anymore.
Yeah.
To me, that's the real loss, because this heart surgeon who's fully trained, or whatever surgeon, has another or nurse that leaves the ICU to do like pediatric daily sort of follow-ups, and that's like 20, 30 years of expertise that patients are directly losing. So to me, that's the biggest threat for healthcare in the next 10 years.
And you've got patients, and there's studies out there with technically the biggest killer of individuals is medical malpractice, not necessarily to the fault of the doctors, but due to exhaustion, due to lack of experience. COVID, great example. You've got people coming in that have very little experience because, as you said, people have to, they're like, I can get a great paycheck to do something that's got no risk, a much lower level of stress. And then I don't have to deal with the system that is checking my P's and Q's. I can't use the things I need to use that actually can make a difference because they're either too expensive or, even worse yet, too cheap. So you go back and forth, and that becomes a major issue with the patient, not just the medical professionals.
Listen, Anthony, there's things that are crazy to me. There's a system in our hospital. You'll love this. It's called Pearl, right? So it has kind of a cute name. I don't even know what the abbreviation is, but it's an anonymous system that allows you to complain, right? But that's okay, right? So you need to be able to say this person wasn't nice to me or whatever. I don't like
Right.
this, or the lights didn't go off, didn't go on. But the kicker is the hospital administration in their sort of big uh, plans of making this all better are rewarding departments for the amount of pearls you put every month. So the more you complain about the system, about the errors, you point fingers at people, the more you're rewarded by the system. How crazy is this? And you know what the background is on this is that they have shown somewhere in some studies in some business world somewhere that the more errors there, the more complaints one individual has, the more money the hospital loses. And it's like, I think if you hit 4 complaints within a year or something like that, it's $1 million risk of lawsuit in the future. So they reward people to anonymously complain on their colleagues and things. How crazy is this?
That's to be
And
expected.
that's the real problem, is that there's this dichotomized system that wants you to be more effective, puts a lot of pressure on people, but then rewards this type of like behavior. Anyway, that to me,
It's like a social credit score. I mean, do you get to name names in that as well? Is it like, do you
no, you
name
can't. It's anonymous, so you can't. Well, you can name, you can
you
point
can name
fingers,
other people's
but when
names
you
though?
receive it, you can't tell who it is. You can tell usually because of the situation, but then that leads to. I mean, it's not like it's always punitive, but this leads to like 6 meetings with HR, and then 2 meetings with your chair, and then sort of this group meeting to make it all better. It's little things. It's not always the person's fault. It's not always that you're angry, but it's this sort of. It would be much more efficient for that person to come and say, hey, listen, can we just talk about this? Sure. And then we move on. But the system has incentivized people to be protective, to compete, to sort of be resentful of each other. And that is, to me, crazy, especially within the current context of burnout and everything that we go through over the last couple of years.
Yeah, it's not shocking that hospitals would incentivize. I mean, it's not even hospitals. This is the world we live in these days, and it's just the incentivizing the concept of tattletelling, and that's coming from somebody. I do believe when somebody sees a crime, stop it. But just because you don't like something from somebody else, their ideology, their opinion on politics, healthcare, whatever it is, we are now being rewarded to tell on people in that sense, and also being rewarded to not tell on criminals. It's a very awkward society that we live in.
I don't know where this is going, but I mean, but it's not surprising that at the end of the day, people will say, you know what, I don't need this. There's a morning when you get up where you don't need to face all of this.
Yeah.
There's a morning, and I mean, I wish some days that the only thing I would have to do is take care of patients. It's a minor. I mean, that's where I'm actually at peace, is when I'm in the operating room operating on a patient, because it's the minute I get out of the OR, is this swirl that you sort of have to protect yourself from.
Yeah.
And I mean, and now I'm like, I mean, I think I'm better at work in terms of like working with people and things. And now I've developed this anxiety. The minute I get an email, from anybody above me that says, "Oh, we need to meet," and things, I'm like, what did I do something? Did I say something? And then my wife's kind of taking a laugh at me. She's like, what's going on? I said, I don't know. I got it. I mean, I didn't have, it wasn't like that. I'd say as close as like 5 to 10 years ago, where you sort of just have to focus on what you do, meaning taking care of patients.
Yeah. All right. So in our last, 10 minutes, 15 minutes, I want to get into COVID. And obviously as a cardiovascular surgeon and what you saw, I mean, you specialize in an area that obviously had a lot of ties to COVID. Let's start off with, what was your initial, as somebody in healthcare, what's your initial opinion on how we have handled the COVID crisis?
Well, I think, I mean, to be honest, I feel like I have a positive thought on it. I mean, the reality is we went through a big, healthcare crisis, probably one of the most scary ones. Nobody knew what to do really. But 2 years later, 2.5 years later, we're past it, right? So the science and the technology around that, I mean, people don't realize that, but the technology and the science around developing a vaccine within a year for something that's constantly changing. I mean, even for people within the system that are specialists in infectious disease is enormous undertaking. So I think that's reassuring to me that our system can handle that kind of stuff, and from a science standpoint. The division is what bothers me. The division of people, the association of a healthcare crisis to politics bothers me. It's not a secret, but if you're a Republican, you don't wear a mask. If you're a Democrat, you're pro-vaccine. I mean, really, we're all just people in the end, right? So we have
Yeah.
kids, we have humans, so that to me is crazy. And that to me was a wrong association, and that probably delayed care and led to potential unnecessary death to me.
Yeah.
And then sometimes for the wrong reasons. Why people made decisions because they want to be reelected. So a small group of people making decisions for 250 million people to me is a crisis still.
Questionable.
For
Yeah.
other topics, yeah. And then I guess the third point would be how, and it's also part of our society's issues, but the media's, the way that COVID was in the media all the time, and the accessibility of not just information, but all of the information. The number of cases, the vaccine, the types of vaccine. I mean, everybody became a living room expert in sort of COVID, which to me is crazy because I don't even understand it. So I don't like how does Bob in the middle of somewhere can have an opinion on vaccines and which type and what so
Right.
so I don't even know myself if I should get a couple of doses or no doses, or when so that to me is an issue. And I don't know if historically we've had that much of a media presence into a complex disease, because we've had other diseases, right, in the past. We didn't
Yeah.
have quite the media focus as it was, and to me that also probably led to issues and unnecessary mortality.
Yeah. No, and based on my tone, I'm sure you can understand. You already know what side I come from, which is medical freedom, in my personal opinion, and a freedom to make a choice. And you said something really important. You said even you don't know everything about the vaccine. Couple reasons: it's very complicated, it was very new, and you're busy. You're doing surgeries, you're doing all these things. So people relied a lot on their medical professionals to give them advice, which is fair, which is what you should do. But again, not a lot of people were vaccine experts. And the one interesting thing, I've had several discussions with nurses, a lot of nurses that believe similar things that I do, some doctors that believe the same thing as I do, in terms of it should be up to the user per se. But the interesting thing is when it breaks down to data and recommendations, and correct me if I'm wrong, doctors typically look at recommendations. You don't have time to go through a whole bunch of data to formulate a response. And we've been accustomed in this country to trusting recommendations before there was such a dollar sign behind something. So in your experience, do you notice that when you guys had, and I'm sure you had this conversation in the hospitals, did most of the doctors cite recommendations, or were you guys actually breaking down the data and said, this makes sense or this doesn't make sense?
Ultimately, I mean, I think people did have a lot of opinions. I call it opinions. It doesn't, whether it makes sense or it doesn't make sense, doesn't really matter. The consensus and the recommendation is what's important. And in science in general, that's what I mean. People are always, so there's a difference between freedom of care and consensus, right? I can tell a patient, you need heart surgery, you need to have bypass intervention. Patient can decide to go and have it or not. It's up to them. If they know the risk that they will likely die within a year, that's up to them. So the same thing goes for that, right? If the recommendation based on the best science, and it's not like people put it on Fauci and people, but like it's I mean, this doesn't come out of nowhere, right? So
Yeah.
whenever a consensus comes for anything, there's like hundreds of people that are getting consulted that are experts within the system. I mean, not just like the guy that's watching on TV. And there's people that have studied retroviruses and vaccines that are consulted to come up with a recommendation. So we got to trust it from a science standpoint. That's one. But then what people do with it shouldn't be politicized. They can decide. There's three aspects. They can decide to say, I want the vaccine or I don't want the vaccine. I know I'm putting myself at risk and my family and whoever to die or to have serious issues, but that's on them, right? Once they know the information, they can decide to have it or not.
But who's providing that information?
What do you mean in terms of what?
The whole, I mean, like you said, like you just said, it was, you can choose to take it or not take it. But if you're not taking it, you're risking XYZ, hospitalization, death, things for people around you, which in the end have been, all studies have been proven that it's not necessarily true in terms of the spread. It's not in terms of the actual ability to get it, protect yourself. There's still some studies showing that if you're boosted multiple times, you are not going to be hospitalized as much. So again, there's that little bit of shred of efficacy, but at the end of the day, who is the one saying this stuff that would make?
I mean,
why do you say it?
You have to rely on consensus, and what we're getting into now is the level of consensus, right? So if you've studied, for example, heart surgery for 35 years, you know that if you have a pretty significant lesion or three vessel disease or left main disease, or you have aortic valve disease, that the mortality is 1 year, because we have thousands and hundreds and years of experience with it. Now, the level of evidence for COVID is probably at best 2A, 2B. It's a expert's opinion based on trends, based on for a very short time observation. So it has the potential of being wrong at times, and that's okay. And because you have to trust something. Now, should we trust the media? Absolutely not. I think we should trust our organizations. Should we trust people that are watching TV or form their own opinion about it? I don't think so. I think people, unless they have a PhD in virology or some sort of expertise in it, I think we have to trust some expert within our society to be the leaders and tell us what to do.
But if there's experts on, and I won't push it too much more. I like having this conversation with somebody that is of the level that should be able to have this conversation. Yeah. And I love that we don't, I think we don't fully agree, which is great. So when it comes to the people that are essentially giving the information, there are doctors and there are virologists, and this is where I get concerned. The ones that disagree are immediately silenced. And this isn't a media talking point. This is some of the doctors I've spoken with, some of the people that look at the data instead of the recommendations. And I'll be honest, I don't love recommendations, especially in a day and age where the pharmaceutical industry
guidelines, right? They're not, the word guidelines means just, they point you towards a direction, but they're not the truth and the holy grail, right?
Right. So that's why I think the idea is talk to your medical professional. What is your opinion on? And again, you've seen a lot of people, I'm sure, with long haulers COVID. You've seen people that have needed different things in terms of their heart and cardiovascular, because it is a lot of vascular issues. What do you say to the concept of mandating something like a vaccine?
I mean, I've got to plead the fifth for that. It's,
How crazy is that you have to plead the fifth as a specialist? And I get why you do.
Well, as a healthcare doctor, I would say I recommend vaccine on all my patients, not around a surgery, not before a big surgery, but in general, because I've seen so much people dying, so many of them. And we had emails on a daily basis of who was dying in the hospital, whether they're vaccinated or not. And 90+% of the time, the ones that are really, really sick and dying were not vaccinated.
Okay.
So just by exposure, maybe to a small portion of them, dealing with families that were devastated. I mean, there were days a year and a half ago where we had 9, 10, 12 people dying on it. It was like we couldn't really stop to watch them die because it was too frequent. It's like being in a slaughterhouse. People like falling one. I mean, it was really unbelievable.
Was this Montana?
Well, everywhere. I've been in Montana. I've been in Montreal. I've been in Minnesota. I've been in old people retirement homes because at some point we were sort of reaffected there in Canada to help. I
Do you
mean,
think we are doing the right treatments? I know how bad it was. I lost. This is coming from somebody that lost people to COVID, so I get it. But looking a year and a half back ago, before we even hit the Delta strain, when it was still the original, like what you had, do you think, looking back, that part of the death, and again, hindsight's 2020, part of the death could have been prevented by doing different things that, in some ways, we're doing now, and also choosing not to do, whether it be therapeutics, and I'm not going to get into the I word or the H word and any of that stuff, and maybe not using things like remdesivir, which I think they're still using, learning more about monoclonal antibodies earlier and plasma treatments. Do you think some of that is what led to such a large loss of life early?
I wouldn't be able to comment on that. I think for other treatments, other treatments could have worked. I think the disease was such an aggressive one that I mean, it's like these diseases in the old days that sort of made populations disappear, right? That's what we were faced with, and thankfully we were able, with science and some guideline, be able to get out of it. But there was scenarios we would still be fully in it, and whether vaccine or no vaccine, I think I mean, you can't argue that a year later we're sort of past COVID a little bit. So,
yeah,
I mean, you can't argue with some degree of success,
Yeah. No, I gotcha. Sorry, this is what we talk about all the time, and it's good to be able to talk with somebody that has real world experience, real life experience. You've been working in the hospitals, you've seen it. I'm not going to ask you, because I don't think I'm going to put you in the position of asking about any of the side effects from a vascular area, because I don't know if you've dealt with young people or athletics. So I won't ask you, or unless
not from the vaccine, but from COVID, I did. I mean, I've seen I've seen a lot of minor stuff, like like a clot in the legs and vasculitis and things, and blue toes and things in young people
from COVID.
From COVID, yep, or long haul COVID. I've seen people die, have strokes from coagulation issue from COVID. I've seen people being on mechanical support for lung issues and heart issues from COVID. So I had treated a young patient in California. Guy was like 28 with no history, just got COVID, really bad COVID, and his heart clotted off, basically. I mean, the whole heart stopped working. And so we put him on support for a couple of days and he just died. So I've seen really terrible things. And we have adjusted as a community in heart surgery, our practice. We tend to wait a little bit until certain markers are lower inflammation before we do surgery, because we know that certain types of inflammation are prone to clots. And so I've had some patients have stroked after surgery that had COVID that were not related to any other issues. We've had some bypasses clot off early because of that, cardiomyopathy, delayed cardiomyopathy. So there's a lot of cardiac related complication.
Yeah.
And so some of them early on really devastating, some of them more chronic, like cardiomyopathy and rhythm issues and vascular complications and things like that.
It's crazy. In the beginning, I talked to some nurses out of Idaho, and they were and we're talking, June of 2020, and they were all under they're like, every doctor here, it's vascular. It's more vascular than it is lung. It's more heart related, cardiovascular, vascular, etc. They were treating, and they were having a lot of success until they were forced to use other methods with basic blood thinners. In all reality, that was a huge way that they were dealing with it. And Idaho had very little death in the beginning in these hospitals that we were talking to.
Yeah, so, and I've had some of that. We do. I mean, when we know a COVID patient need a emergent heart surgery or vascular procedure, we use more heparin. We double the dose of heparin typically, because we know that their system is a bit different. it's a really, I mean, it's not a black or white area, but there are some evidence that people, even with the history of stroke on COVID, will have a recurrence with certain types of anticoagulation. And so based on certain levels of inflammation, some hematologists, and every hospital is different. If you're at the Mayo Clinic or some of these bigger places that have studied it a lot, you probably can find a hematologist that can help you. The reality is if you call a hematologist in our hospital, in any hospital, most of them, they'll say, we don't really know, so you can just do whatever, but there is a definite, there's definite challenges into trying to find the right recipe for these people.
Yeah. So last COVID question, and we'll wrap up and circle back to obviously the book and your final thoughts. So you sound like you dealt with a lot of death, obviously being around it, being in there. In terms of COVID patients, the big question that I'm curious about, I mean, it sounded like the 28-year-old was young and healthy. I don't know if the comorbidity side, out of the people you saw really struggling or having long haulers COVID to a point where it is still affecting their daily lives, how many of them actually had comorbidities, or how many were fully healthy?
I mean, for long haul, I can't, but I mean, a lot of people with comorbidities were really sick with COVID. A lot of the stuff I saw was age, obesity, and diabetes. So the smokers, so the four main ones. And it sort of adds up to what we were talking earlier, right? It's a disease that's systemic and sort of affects the lungs, the kidneys, the vascular system. So anybody that has an sort of underlying issues with that, whether it's through obesity, smoking, or anything, so it sort of puts them on steroids in terms of having issues. And definitely the ones that will translate into longer haul syndromes and things like that. And perhaps these are the ones that could benefit from some of those technology that you were talking about, or other treatments that you're talking about. On the other hand, there's a small proportion of people, I would say kids, but young, surprisingly young, healthy people that have no issues prior, that have had really hard time getting outside of getting, the recover from COVID. And so I think it does hit majority of people with comorbidities, in my opinion. But it does have a idiosyncratic effect on people that are healthy, or have been healthy or healthier. I think it does have there's a correlation with how bad you get the inflammation response. I think if you have a big inflammation response, your system has a big inflammation response, you're more prone to complications acutely, and then sort of longer term issues.
Gotcha. All right, cool. Well, thanks for taking the fire on that one.
No problem. We're sort of used to that kind of stuff.
Yeah. Not always on camera though, I'm sure. So, so let's circle it back. Obviously, I'm going to throw the name of the book up and some of the things. Let's talk real quick about some of the things that you've done. Book name: Healthcare Anonymous. Put yourself first to avoid anxiety, addiction, and burnout. You obviously you have a breadth of knowledge in terms of the cardiovascular system, surgery, and also how to essentially get your mind right to get back in there and save lives as a medical professional. If there's one big message you can pass on to people that are in medical school right now, or to those thinking about going to become a nurse, a doctor, or whatever, what would be some advice that you would give them as somebody that is a keynote speaker and speaks to audiences like this all the time?
Yeah, I think the message I give after my talks, the key message is it's okay not to be okay, and not to wait until you feel like you're an outsider in your own body, not to feel like, don't create this, this is from Jim Carrey, but don't create this avatar of yourself to deal with your struggles, right? Because it catches up, right? Don't create this person that you can't recognize dealing with some of the struggles. So speak about it, realize that it's okay not to be okay. And I think do it early and speak up about it. And so in medical schools, I don't think we do enough for mental health. The classical teachings, the culture of competition, of being resentful among each other and things. So I think that's where it starts, right? And where you teach you how to be in healthcare, whether it's nursing, whether it's medical school, whether it's, so realizing that to me is the threat to the future.
Last question. Why did you get into the medical field? Why did you go to school for it? Why do you want to become a doctor?
Well, the honest question is that was, I mean, I wanted to be in philosophy, really. And the pressure, the external pressure to go, I had the highest score coming out of college, and I wasn't even trying. And so my mom was saying, well, you can decide later, you'll make money out of something, and then you can decide what you want to do later. That was the real push to go into medicine, really, until I took some steps to really find what I liked into it, to really, serve patients the best that I could. But and then I talk about it in the book, and I hope that a lot of us have done this for the real good reasons, but I doubt that deep down a good proportion of them have not done this for the good reasons, and that's why they end up in situations where they struggle and they affect the patient's care as well.
Got it. All right. Well, again, guys, go ahead and find this book on Amazon. You can just look it up. It was easy to find. Healthcare Anonymous, Put Yourself First to Avoid Anxiety, Addiction, and Burnout. This is Dr. Simon Maltais. Thank you so much for being on. Sit tight. I'm going to go ahead and stop the recording, and then we'll chit-chat real quick. So thank you again. Final words?
Yeah, thank you for the invite. Healthcareanonymous.com if you want to have more information about testimonials and things like that. So you can get more information about the book. Thank you.
Anywhere else they can find you besides that? Healthcareanonymous.com?
Breakthroughpoints.com. You can find the book, but more information about challenges in high intensity environments and things like that.
Awesome. Thanks a lot, Doc. Take it easy.
Thank you.
See you later, everybody.